My name is Adekunle Jimoh. When I'm in the clinic, I'm doctor. When I'm here, I'm Adekunle Jimoh. It is really nice to be in the presence of the Lord and with brethren. Thank you very much. So it is good to be at PraiseVille Parish, and we shall quickly say a few things. I don't know if someone will help me with the slides. I have my own here so that you can also follow. This is essentially academic. We'll focus on a couple of things as we go ahead. See, the topic is health is service. And really, it was purposely chosen so that we can look at a few things. When we say service, what are we thinking about? So we'll go through that. Yes, there's an aim, there's an objective. But you see, this topic is more than a combination of words. It is a ground to bring to our realization the importance of self. Yes. Okay, we can move. It is a nudge to the consciousness that our collective wellness is as strong as the well-being of the individual entity. So health is service is a profound statement. It is an injunction that pushes us to the truth that health is a duty first owed to ourselves. It is when you have something, when you have good health, that you can perform, that you can minister. Please. And it is in the background enlightenment that it is within such personal wellness that the river of well-being can nourish others. And key things that we want to talk about: health, family, wellness. What is health? Most of us from school have heard health is a complete, WHO says, complete physical, mental, and social well-being. Yes, that is what it is. But over the years, the definitions have changed. But one thing we should know is that health is a continuous way in which we adapt to changes in life. And life will indeed throw things at you. But when it throws these things, you need to be able to adapt. And that is where we're going. So what is wellness? It is that active process which we're about to learn here, in which we choose to make correct, optimal decisions about our health and to be successful. What is family? We all know what family is, but I'm going to give you our own definition and say a family is a social and intimate group of individuals related either biologically, legally, or by choice, from whom a person can expect to get a reasonable measure of support in the form of food, shelter, finance, and emotional nurturing. Now, when we're talking about wellness, what are we really talking about? Physical, mental, social. And I want us to go to a certain page. Slide, please, if you can get us to slide 13. That's where the meat of the matter is. So when you see this is really what we want to talk about today. But before we go to this, the Bible that you are holding, the Bible that you have, is an excellent resource for what we are going to talk about today. So you look at the nutrition there. On our path to wellness, you need to eat certain things. And number one thing we need to focus on is plant-based diet. So let's not speak too much English and look at the book of Daniel. When Daniel was in captivity, there was something that Nebuchadnezzar offered him. Offered wine, meat, and it was a royal feast. But Daniel and his own friends, they chose, we want to have vegetables, fruits, and water. And after a period of days, there was a test. Who is looking healthier? And of course, they were looking healthier. See, that thing that was said in the Bible, it is what medicine is saying after profound years, long years of study. So, that Bible that you are holding will always be an excellent resource for a lot of things. So, on the nutrition, what do we really say? Let's eat vegetables, fruits. That is not to say that we should be vegetarians. Meats, fish, you can eat them reasonably. However, red meat has been shown to increase the risk of some cancers, risk of so many constipation, diabetes, hypertension. So let's reduce it as much as possible. We are not here to say you should not eat this, eat that. Let us lean towards moderation. But red meat is something that really we need to bring down. Plant-based diets, let's increase those ones. And what are these things? More vegetables, more fruits, legumes, seeds, nuts, very good. We prefer fish, chicken, turkey, the white ones, to the beef. If you really like meat, goat meat is okay, but then in moderation, please. So the next thing we want to talk about now is when you say nutrition, of course we also need to eat whatever you want to eat in moderation. So this is what the kind of counsel we give. You want to eat rice, look at your feast. Eat rice, your feast. Put a lot of vegetables. Yeah, it seems small, right? Mm-hmm. Yeah. So the way to go around it is, that is what you eat at once. When you are hungry, you can eat again. So every time you eat that, the body is able to manage what you have taken in. Then, you see, that rice is what you are looking at. When the rice in the plate is just this, then you put vegetable times 3 of this. So that increases the bulk of what you are going to eat. So it's going to fill you up. But if you really need to eat more, let that be the meal per time. You are hungry in an hour, in 2 hours. Rice, eba, amala, pounded yam, 1. Vegetable times 3 of this. Then you put your fish. Please. That's the practical way of doing it. Let's reduce beef. Risk of, particularly red meat, gout, so many medical conditions that have been linked with red meat. Now, exercise. We're going to list the 4 major things that are leading killers in the world. We'll start with hypertension, diabetes, cancers. Number 4 is physical inactivity. So when you just sit down and you want to go somewhere on your bike, you get into the car. No. Please exercise. When you exercise, it has its own mental input. You're likely to have better cognition. The muscles move better. Digestion is better. The risk of hypertension, lower. Risk of diabetes, lower. Risk of obesity, lower. Risk of cancers, lower. So really, how much of movement do we need? So we say, at least, all of us have nice smartphones, 10,000 steps every day. 10,000. So, if you can't do 10,000 every day, medicine is not rigid. And particularly as family physicians, we can reach common ground. If you cannot reach 10,000, do something. Just move every day. If it's 15 minutes you can move, then you can. If you have only 15 minutes, run. If you have more time, 45 minutes, 1 hour, you can walk. Walk an hour every day, 5/7. If you do 3/7, you know that's not pass mark. 3/7 is less than 50%. So whatever you do, move. Even if you are so busy, you can time yourself. Every 2 hours, let me just move. Risk of hypertension is low. And when our clients come to the hospital, we tell you, we check your BP today and it's saying 150, for example, 150, 70. When you start exercising, exercise alone without medications reduces the BP by as much as 9. So from 150, you're already 141 with exercise. You reduce salt. Beautiful. You reduce Maggi. Yes. So we are going to talk about those ones. So you see, these are our Maggi. Please. I'm not against people that are making Maggi. Let me say spices, condiments. As much as possible, let's reduce them. Minimal salt. So you also read, all of us here, we are doctors now online. We check this one. They say salt is good. Salt is good in moderation. Sodium salts in particular is one of the main reasons why a lot of us this age we have hypertension. Potassium is better. But nobody will start going to look at the books, potassium, sodium. So what do you do generally? In your food, minimal salt. As much as possible. Reduce. No. Ajinomoto. Maggi. Reduce. The aim is to stop. But then, the Bible says, despise not the days of little beginnings. So at least let's start from somewhere. Reduce. But salt as minimal as possible. By the time you reduce salt, exercise I said will reduce about nine from the blood pressure. If you're 150, you're about 141. By the time you reduce salt, you're already getting to 130. You reduce carbonated drinks, because that's something that all of us like carbonated drinks, Coke, Fanta. There's something my mother does. My mother likes Coke, so we started disturbing her. Mommy, please stop Coke. Okay, said I've stopped though. Okay, so I went to check her home. You have stopped? Hey, come and see what I now take. She opened her bed, and I saw Pepsi. Me more Coke more, Pepsi more. Mommy, these things are just like they are synonyms now. Say no, this one is not as sweet. Okay, despite all the days of little beginning, if indeed it is not as sweet, but then we still need to reduce the frequency. If you are taking it, I have friends that take Coke, 1 bottle every day. Please reduce it to 1 every other day. Then maybe we'll get to the point that it is 1 a week. It's point that we now say, okay, 1 every other week. Yes, we can't move from doing something to 0. Yes, we know. Gradually. So let me quickly remind us. Processed food, let's reduce it as much as possible. A lot of fruits, vegetables, red meat, please bring down. Fish, excellent. Salt, reduce, please. Reduce. Maggi, no, whatever name they call it. Don't mind me, I'm always saying Maggi. That's the one that comes to my head. I have nothing against Maggi. Let's reduce all those ones. Exercise. 10,000 steps as much as possible. If you can't do that, please move. You don't need to run. If you can't run, walk. If you can't walk, crawl. Just move, please. Yes. Now we'll go to substance abuse. So there are several substances. Alcohol, cigarettes, and the likes. Even Proverbs 23:20. What does it say? Does anybody have a Bible there? Please. Proverbs 23:20. I think it says something about not being quite tending to alcohol amongst other things. No, Proverbs 23:20. Thank you very much. Be not among wine bibbers, among riotous eaters of flesh. It seems like the Bible has been saying these things since. What studies are now telling us, the Bible has been telling us. So, essentially, as much as, yes, we see people now, you can see that there's a pandemic of alcohol in our population. You see people, they take this thing that they call Fenija, they tear it, and so really, let's be a bit practical. If you are going to take alcohol, let me tell you, please drink NSC. Drink good alcohol. Really, and drink in moderation. You see, when you take, the truth is you should not take alcohol. Or, the newer studies have said that there's no form of alcohol that is good for your health. That is what studies have said. But we are not book people. We know that people will drink. So, okay, let us tell you, drink as minimal as possible. But then, if you are even going to drink anything, so you can drink wine. You drink a glass of wine, you are celebrating. That's okay. And you drink good wine. So when you drink wine that is brewed from God knows where, you cut it from your mouth, you take it, risk of kidney problems, liver problems are very high. Please. So I'm not talking only as a doctor. I have first-hand experience with alcohol. And I know that apart from what alcohol can do to your health, alcohol will purify your finances. And you see, the word is purify because it's not going to really grab it. Slowly, but surely, how your money will go. Please. So, of course, I've mentioned alcohol because we always say reduce. When we talk about cigarettes, nobody negotiates that. Do not smoke for any reason. There's only one benefit of smoking. Only one. It reduces the risk of endometrial cancer. It reduces the risk. So, but you can now have lung cancer. You can have renal cancer. You can have, so you see, you might as well just stay off it. So, and if you are a man, okay, that means that cigarettes has no benefit for you. You don't have endometrium anyway. Endometrium is the inner lining of the uterus that our women used to carry the babies. As a man, cigarettes will give you testicular cancer, brain cancer, hypertension, diabetes, every no comment. Let's every bad thing that you can think of. Please, there's no need to belabor that. Let's just stay off cigarettes. Now, the fourth thing here is healthy relationships. So there's an ongoing study by Harvard, has been on for almost 85 years. And what they were trying to find out is, what is it in this life that helps people to live longer, happier, more fulfilled, and successful? And over these years, what they have found is also in the Bible. You know how the Bible says, do not neglect the fellowship of the brethren. It is not really that it's not just something that it is written there, that it is said. Because it is good to fellowship. You need to be with family. You need to be with people that they care about you, that love you. There's another study I'll quickly mention. So when you give birth to a child, and this was done, you give birth to a child, you nurture one, you touch, that child is likely to survive. Unlike you give birth to a child, you just pass food there, no touching. Put everything that the child can eat, whatever, just leave. The child will die. So really, it is not about you eat, or you need love. And that's why I was trying to define family earlier. You need companionship, proper companionship, in the context of God. But then, really, you just need healthy relationships. It is in fact, it is the most important of all these things to be successful, to live long. Whatever thing you do. You know, the Bible also says it is good. Yes, when you are one, you can run. But when you are two, what you can achieve is exceedingly abundantly greater than what you can think of. Really. Yes, so we're still going to go back to all of these things. But let's quickly look at stress. When you have acute stress, something happens. Hey, the body adjusts. But when there's chronic stress, then the risk of so many problems start. Depression, illnesses, your immune system goes down. So you need to constantly tell yourself that this stress will not get me down. So how do you remind yourself? Because even medically, what medicine has told us about stress is how do we help people with stress? Mindfulness. Talk to yourself. Get in contact with nature. But Christians have extra resource. What does the Bible say about those things? You remind yourself, I know the plans I have for you. Plans of good and not of evil. To take you to an expected good end. What does Philippians 4:6 say? Petitions, bring everything. And I like the next one. At the peace of the Lord that is above all will now. So that is you getting away from stress. That is an extra resource that if you are not a Christian, you may not be able to tap from that. So please, you are in a place that you are properly hooked. Tap. Please. Now, sleep. 7 to 9 hours of sleep. Very, very important. Very few of us will get it. Yes. So 7 to 9 hours of sleep is very important. It restores you. But practically, you are working in VI. You live in Ikorodu. We all know. But then, because there's sleep, rest is non-negotiable. If the Lord used 6 days and rested on the 7th day, that is a primary injunction that you must rest. And God has prorated in a very nice way. So you yourself prorate your sleep in a way that at least you have restorative, at least something to get you back up. Please. Saturdays, and you have to be practical. You have been working Monday to Friday, and Saturday you're thinking, yes, I have to sweep everywhere. You can get somebody to help you with that one. No. You need rest. By the time you are much better, the next week you are flowing better, your immune system is better, risk of hypertension is lower, risk of diabetes lower. 7 to 9 hours. That's what the book says. But then, like I've said, we are not here to discuss books. You are going to make it as practical for yourselves as possible. But really, when it's less than 5 hours, as much as poverty may want to pound if you oversleep, other things can pound though if you don't sleep enough. So please, let's endeavor to get restorative sleep. Please. Next slide, please. Yes, so we have talked about most of all this. Next slide. Yes, we cannot overemphasize the need for strong social connections. You will not be successful without this. The sense of belonging, the same thing. You need to be able to communicate well, a good support system. Yes, community. Yes, balancing social needs. Next slide. Mental wellness. We have spoken about that. Yes, next slide. Okay, the next. Thank you. Yes. So in all of these things, what have we been saying? Health is a service first owed to yourselves. It is when you are well that you can nurture others. Please, you need to prioritize yourself, understand yourself, and it is that understanding that you realize that, okay, I used to drink 3 bottles of carbonated drinks every week. Now I'm moving to 1, and I'm going to reduce it gradually till it becomes once in 2 weeks. I'm not here to say don't do this, don't do that, but you need to properly adapt things to fit into your own lifestyle. You need to check yourselves, particularly if you are older than 40. As you get to 40 and above, even if it's once a year, you know how all of us will be driving cars around, we'll be servicing the car every 3 months. We'll not service ourselves. Go there, let them take blood samples. Simple things, full blood count will tell us how is the blood level. Is there any risk of infection? There are things that will tell us, is it bacterial, is it viral? We will know. Risk of iron deficiency, we can tell us, just that full blood count. Risk of folic acid deficiency, it will tell us. Vitamin B12 deficiency, full blood count will tell us. They will do electrolytes and kidney function. How is the sodium level in the body, potassium, chloride, bicarbonate, all these things. Kidney function, then you can do urinalysis. The urine is one of the most beautiful ways to check the body. And I always joke that, you see, I work in a few hospitals. In one of them, people come in and they say that, doctor, 500 naira in Momua's hospital. So when someone brings 500, you can't chase the person. The person has come to get care. So how can you help that patient with 500 naira? You pick the most appropriate test that can reveal a lot. And in that hospital that I work sometimes, and most times in fact, about 400 naira, that's what urinalysis is. And that urinalysis will tell us how is the liver, how is the kidney. Is there an infection in the urinary tract? Is there a stone there? Is there diabetes? Can there be things that the kidney is being affected that can tell us about hypertension? The urine will tell us. Of course, if you now get to bigger places where the person can afford more, you can help the person open up and do full blood count. But if you have 500 now, then we'll align with what you have and do analysis, and it will tell us a lot. So that is one test that, if for any reason they say, this is the only thing I want to do analysis. It's inexpensive, it's fast, it's immediate. Within 2 minutes, the result is out. We explain it to you. Men over than 40, prostate. Let's just check your prostate. You are not likely to have any problem, but it also helps us to have a baseline. We call it PSA, prostate specific antigen. So we look at it and it tells it's supposed to be between 0 and 4. By the time we see it, most likely you are less than 1. Good. The next time you are checking it, a year after, we want to see, is it gradually going up? Is it around the same range? That's what we want to know. For women are much more blessed in the sense that women have more encounters with the hospital. When a woman is pregnant, she'll go. They'll check her. So she kind of is continually in tune with how her body is. She can tell you, I know my PCV used to be like this. Most men are busy hustling. You're not checking yourself. Extra things that women should do. Pap smear. One of the things that, I mentioned the 4 things that are killing people the most. Number 1, hypertension, cancers, diabetes. Number 4, physical inactivity. But of those cancers, cervical cancer is very, 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 very much with us. If you do a pap smear, you can detect it. And pap smear is not expensive, and cervical cancer is potentially curable. You find that there's a problem now. Quickly. You start to tackle it. There's also immunization you can give to the children that can prevent them from having cervical cancer. So please, let's know about this and explore. Breast scan for women, please. Very important. When we check all these things, you have a file. You should have a file for it. When I did this was what it was. You put it there. The next time you check, you can look at how it is progressing. Please, it's very important. So let's periodically check ourselves. You cannot but be intentional about family. You cannot be hustling and you are not giving you need to pay attention to the family. That is essentially your life. And this is also your family. Your household, your family here, you need to pay attention to it. There's no amount of work you are doing that you cannot afford to strike a balance. Please. It is very important. Again, next slide, please. We'll go back to what we have been saying and we'll summarize. Nutrition, please. Rice, eba. Your feast. Vegetables, plenty. Reduce red meat as much as possible. Drink a lot of water. We usually say that 3 liters. In this part of the world, the sun is so much, it takes a lot of water from the skin. We call it insensible loss. So please, at least 3 liters is good. And this is how you can tell. You go and pee and your urine is yellow. Drink more water. When it is clear, you are doing well. Continue. Carbonated drinks, reduce. Reduce Maggi, reduce Ajinomoto, whatever name it is called, as much as possible. Even salt, just a pinch of salt. So I always tell people that I've stopped adding salt. I've stopped using Maggi anyway. Any of those things, I've not used them in the last maybe 18 months. Whatever I cook, rice, no salt. Now I don't know whether they salt. This thing is an acquired taste. After a few months, you adjust to it, you won't even know it's good. And it makes it better. I checked my BP at some point 18 months ago. I was asking myself, how old am I now? By the time I started exercising, fruits, vegetables, reduce salt, I was feeling, yes, this is where I should be. 112/65. Please, let's do that. Processed food in whatever form. Nobody says you should not eat biscuit though. In moderation. Particularly for children, please let them eat biscuit and play. But as you get older, let's reduce all these things. Anything processed. And that's why most people say, let's eat ofada rice. Because it's not processed. And it's better. And we always remember the story of Daniel and how they were more healthful. Exercise. 10,000 steps. Let these our phones and wristwatches, let them help us to see how much have you worked. Please. Substance. We already agreed. Cigarettes is of no use for anybody. Please stop. Alcohol. Studies have shown that it has no benefits. If you drink, make it as minimal as possible. Please. Because the risk of so many things are there. Hypertension, diabetes, cancers, liver cancers in particular. Healthy relationships. We cannot overstate this. The study, like I said, from Harvard is still ongoing, 85 years. The best way to have healthy, successful relationships, life, is by having good relationships. Sleep. I'm going to leave that stress and come back to it last. Sleep. About great. 7 to 9 hours. Very achievable for children. As we get older, we need to formulate something much more adaptable for us, adults. Please. Stress. We need to be able to manage this stress. Please, how do we manage it? As Christians, you have extra resource. You need to talk to yourself. People have gone through this thing and they have done well. I can also do it, and I will also do it. Really. For I know the plans I have for you, plans of good and not of evil, take you to an expected good end. Next slide. We're about done. Next slide. So yes, choose today the route to better health. Owning it as a duty first to yourself, and then your family, in whatever definition you choose, is second to none. You have a companion in us, family physicians. The best version of you is your healthy self. Any other thing? Next slide. If you do not take care and charge of your health, who will? Thank you.